CDO is a nonprofit organization founded in 1992. For over 18 years, we have provided emotional support to thousands of individuals and families worldwide. CDO offers a personalized networking program, 24/7 parent-to-parent online support, free library, and much more. If you or a loved one have been diagnosed with a rare chromosome disorder, CDO is here to help. You are truly not the only one out there.
My name's Jen, this is my husband Jeff, and we're the parents of Tommy. He's our typical little boy, 8 years old, and our daughter Rose is 4.5, and she has partial trisomy 10q, translocated on the 16p terminus. We originally found out about this diagnosis a few weeks after she was born, but we knew when I was pregnant. They gave us an alpha-theta protein test, and that determined that her chances of having something wrong, they assumed it would probably be Downs, was 1 in 3. And there were several different markers in the pregnancy when they did the level 2 ultrasounds that determined that something was quite not right with Rose.
Well, they noticed a couple of markers right off the bat: enlarged brain ventricles, enlarged renal pelvis, which is an area in the kidney. Just some very obvious markers that something wasn't right. On the growth curve, she began slowing down, and gestationally she was on time, but as we went along, we noticed her growth was very slow. Brain ventricle size didn't change, so the brain just basically grew, and ventricles stayed the same. They were on the outside of the tolerance, but we felt pretty good about the pregnancy.
And then they did offer us, about 20 weeks, they did offer us to do an amnio, but what we felt is that no matter what was wrong with Rose, that she was our daughter and we were going to keep her, so we opted not to do the amnio. So we didn't find out till a few weeks after she was born the exact diagnosis that she had. But when she was born, she did have several different problems. She had problems breathing. She was very lethargic. She had problems with feedings. She was born with 6 fingers, and 2 sets of 2 of them were stuck together.
We knew there were some physical abnormalities that indicated that there was definitely something wrong. I guess one of those immediate markers is an enlarged bridge of the nose, or a wide-spaced bridge of the nose, low-set ears, and wide-spaced nipples. That's apparently a very common marker for a significant chromosomal abnormality. Apparently it's seen in Downs or any heavily impacted child with a chromosomal abnormality.
Her first year of life was a lot of ins and outs of the hospital. From there they ran a whole gamut of tests. They did MRIs, CAT scan, blood work, they did a spinal tap, and they weren't sure what was wrong, what was causing her to have these blue episodes. Several days into the testing, they did diagnose her, amongst other things that she already had, with something called central and obstructive apnea, where her brain doesn't always tell her to breathe, so then she had to wear a monitor. And the monitor monitored her heart and her breathing. And she's had, since then, she's also had a lot of other diagnoses. She's had infantile spasms. She has a lot of the weak muscles. She learned to walk when she was 3 years old. She has developmental delays. She has, she's pretty much very limited verbally. She can say hi, she can say tata and dada. But she is 4.5. She does have a lot of feeding issues still, but that goes with the motor skills that she has, that she's lacking in, a little bit of sensory issue, and a little bit of the signaling of the brain, not telling them the mouth and the mouth muscles and the tongue how to coordinate properly. Since we were first diagnosed with the trisomy 10q, we did a lot of research online. We found a wonderful website online with a bunch of families with kids that do have the partial trisomy 10q, and how the founder of the website put together a wonderful presentation and how different segments of the chromosome affect different parts of the body, the liver, the heart. And it was very informative, and it gave us some ideas as to which type of questions to ask doctors and her specialists, because at one point she did have up to 14 different specialists, for allergists, for pulmonologists, cardiologists, you name it, the poor child had it. And she's had a real rough first 2 years of life, but as time went on, she has exceeded any and all of her doctor's expectations.
Far exceeded.
They thought she would be pretty much wheelchair bound, nonverbal, very limited life, tube fed. I mean, she does have a lot of obstacles she does need to overcome, but she has surpassed pretty much anything that they originally thought.
Even the physicians, when they first saw her, that see her now, are just, they're beyond words. I mean, I think one of the initial diagnoses was that they didn't expect her to even be able to roll over. So I think we've done pretty good so far.
She's doing good.
We've been very blessed.
And one of the obstacles we've come across is the lack of personal time. I mean, it has gotten better as Rose has grown stronger and she doesn't have therapies every single day. Her immune system has strengthened, but it is hard because she does require a lot of help. She is 4.5, but she's more equivalent to like a 1.5-year-old. So, and she does have problems with her vision a little bit, with walking and balance. So there's always a little bit of a safety issue there. But that's one of the things that you have to pretty much try to look at how the glass is half full and see how far she has come. And we do a lot of tag teaming so that each person does have a little bit of personal time, but it does definitely affect the family, the relationship. And I found a support group, and it's great to bounce ideas off of different moms out there. You can use them for different resources. You can, here's this therapy. What do you think? How has this helped your child? You see, I'm noticing this sign or symptoms. Has anybody else experienced any of this? But it's only once a month, and it's of a different school district, so they're not a bunch of families that are out here. And that's one thing that's hard is there's not a lot of networking local to here. You have to kind of travel for it.
Well, there's family networking, and then the other thing we discovered was the lack of collaboration between physicians. So you almost need to, my wife was really, really diligent about documenting everything that was going on with Rose. We learned early on that the doctors want to establish trending. So she set up and began photocopying a daily chart of what she's eating, what time she's eating, how much she's eating, what happened afterwards, what medications is she taking, every day. And we were able to submit data and
to see if there's any patterns, or to see if medicines are affecting. Yeah. One of our fears is we don't know what to expect down the road. We don't know what to expect financially down the road because our government doesn't offer very much assistance, and she doesn't qualify for anything, even though she has had a very in-depth medical history and has been very needy now that she needs hearing aids and glasses and all the therapies and such.
Operations
Left and right. You'd think that she'd qualify for some type of assistance, but nothing. And pretty much our hopes for her are to lead a happy life. She's a very happy child. She is never upset. I mean, it has been...
To establish a sense of a quality of life, so that she can be an individual and be happy and experience life.
Mm-hmm. And she's very laid back, and she's a very enjoyable child. We just don't want our son to be given the burden of having to take care of his sister, and that to be something that's core in his life. We want him to be, and he absolutely adores his sister, but we don't want him to feel like that is something that he has to take on. We would love to see her in a group home setting with her peers, and then obviously a lot of family interaction, because we do have a large extended family, and we'd hope that we would be something that would be possible. But like I said, that's few and far between, the families that can get help for their children and place them into a group home setting so that when something does happen to us, it's not shell shock on the child.
The other is financial planning, making sure you have somebody that can help guide you through today, tomorrow, and the day after that. We found out during our research that there's something called a special needs trust, which when Rosie turns 18 can be a supplemental source of income beyond what she gets from SSD or SSI.
But you need to have money to put into the trust.
But you need money in the trust. You need to have somebody overseeing the trust. making sure that anything taken out of the trust is used exclusively for Rosie's benefit. There's a lot of legal issues and tax implications, and if it's not done correctly, it could be really detrimental.
One of the things we use for coping with the stress is we do a lot of family time. We have a lot of fun as a family.
Where's your buddy?
In the beginning, we had to very much just rely upon ourselves and the immediate family because we couldn't go out and do things with Rose because she was medically fragile. And it did strain some friendships on some different avenues that we used to go do fun stuff, to the movies or to the park and such. We always had to take into consideration the different obstacles that would incur with Rosie. Was she going to get sick? Is she going to, catch the flu? Is this going to result in going to the hospital? And something else that's been helpful.
We sort of found ourselves almost placed in self-imposed isolation because she was taking drugs that were depressing her immune system at the time. If she was exposed to anything, she would get it like that, and then we were in the emergency room for 7 days. And those are things, if managed properly, you can avoid getting the cold, you can avoid the expenditure, you can avoid the stay in the hospital. So we really did, unfortunately, become hermits for a year or a year and a half. And you have to love your child with all your heart, because that's the only thing that's going to make your child go, is you.
And some advice that I'd give others is you have to be your kid's advocate. Second guess the doctors. Ask questions, research.
Absolutely. We were very, very fortunate in finding some wonderful physicians. Once you find a good physician, cultivate that relationship, because they will point you in the right direction. They will help mentor the process because they've been exposed to other things. And in learning how to work with them, you'll find that they will guide you in different areas that you wouldn't quite expect. We've been very fortunate that way.
Yeah. And it's very important. Just trust your gut instinct.
Oh, absolutely.
It's the most important
For the
thing.
husbands and the fathers out there, don't disregard the sixth sense that a mother has. That's first and foremost. There are times when even doctors would say, oh, you go in and they listen to the chest, don't worry, it's just a little bit of wheezing, and then you bring your child home and then she says, no, something's not right. Next morning, you're in the emergency room with pneumonia. Don't disregard a mother's sixth sense. It's probably one of the most important aspects of your child's health.
And the other avenue is use the CDO website. Post questions, ask questions, get examples, get recommendations, referrals from other members out there. They've been in similar situations. They may have different avenues for you to pursue that you would never have thought of. There's a lot of different things out there, and there's a lot of advice and a lot of good resources that are out there, but you have to do a lot of digging to find them.
Sure, and document. She put together another valuable piece of paper, which is a health history of Rose, what she's been through, so that when you do see a physician that you don't know, emergency room, everything is there, historical. What happened when, what drugs were applied, what tests have been given, what's she been through, so that you don't have to recount it on history, because it's really hard when you're trying to get your child well and you're spending another hour recounting her life to somebody that doesn't know her, when you can just hand a sheet of paper and they can scan it and say, I get it. So document, and keep it on hand. If your child gets sick, keep a travel bag ready to go, packed and ready to go, toothbrush, underwear, soap, so that you can stay in the hospital.
Can you say bye-bye?
Chromosome Disorder Outreach, Inc. is a nonprofit organization providing support and information to individuals and families coping with a rare chromosome disorder diagnosis. Each individual's situation is unique, and we urge you to always contact your personal health care provider if you have questions or concerns. The views and opinions expressed in this production are not necessarily those of CDO, its board members, or medical advisors. CDO does not recommend or endorse any particular health care provider, researcher, or medical treatment.